Hey everybody, Cody Barnett over at Bodyworks Physical Therapy and Concussion Center, and wanting to show you some of the new technology we've been using to make our foot orthotics. As many of you know, we've been making foot orthotics for well over 30 years, and but we've got a new way that we do this, and it's super cool, and it allows us to do 3D printed orthotics and some really neat things. So I'm going to give you a quick tour of how this works. So if we're going to scan a foot for this, it's important that we get a scan that's non-weight bearing, so she's not standing, and we want to make sure that that we match her foot contours exactly. And so using some new foam technology, what we're able to do is position her like so, and then basically the cell phone will paint the contours of her foot in 3D. And so what you end up with is a 3D model of her foot that we then send to our lab, and they'll use that 3D to make the orthotic so it fits her foot exactly and precisely. Really important to note, we do this with her non-weight bearing, because if you think about it, if we're going to try to match her foot and support her arch, we want to be able to do that in the position before it hits the ground. So you may have seen some types of orthotic measuring devices where the person stands. Well, the problem with that is once somebody's standing, their arches have already collapsed, and so we're not matching their natural arch position. So it's really important that we do this with the person laying down so that they're not putting weight on their foot. The other thing that's neat about this new technology, it allows us to do 3D printed orthotics. So I'll show you an example of that. So there's different types of materials that we use for different foot types, different foot mechanics, and different types of shoe wear. So for example, this is a 3D printed orthotic. This will end up getting a top cover over it that's soft and cushiony, but this is done off of a 3D scan like we just did. This is an example of a carbon fiber orthotic. So carbon fiber is like what they make airplane wings out of, and leg prostheses, that sort of thing. But the carbon fiber has its own properties that are beneficial for different type of foot types or activities that people do. And then lastly, this is an example of a polypropylene device. Out of polypropylene is a type of plastic. So we pick and choose, do we do 3D printed, do we do carbon fiber, do we do polypropylene? We make those decisions based on the activity that you do, the problem that you're experiencing, the type of shoe wear that you use. All of those things factor into how we decide and prescribe the type of orthotic that we're going to be using for a particular person. So last thing I want to chat with you about is people are oftentimes are worried that orthotics are going to be very hard and rigid, and so part of that depends on your foot mechanics, and it also depends on your body weight. So for example, this one's pretty firm. If a person weighs, say, 110 pounds, this is going to be really rigid. We're not going to use that with this person. But if a person weighs 250 pounds, well, this is actually going to be very flexible for their foot mechanics. So we're able to vary that so that it's not, these are things because they match our foot contours precisely, and because we prescribe it based on all of those factors we discussed, it allows us to individualize this and make it perfect for your particular situation. So if you have interest in this, just learning more, have questions, maybe you're intrigued and just want to know if it's the right thing that would be helpful for you and your foot problem, let us know. We use this for plantar fasciitis, Achilles problems, knee problems, even hip and back problems sometimes. And so shin splints, plantar fasciitis, Achilles tears, Achilles injuries, medial knee pain, all of those types of things that this works well for. So if you have questions, want to learn more, feel free to reach out. We're at bodyworksphysicaltherapy.net, or you can call us at 316-558-8808. And until next time, we'll see you later.